Hi, and welcome back to the Fortify Your Brain Summit. I'm Betsy Schroeder, your host, and today I have as my guest Dr. Robert Zembroski. Dr. Zembroski is the director of the Darien Center for Functional Medicine. With 27 years in private practice as a physician, specialist in functional medicine, chiropractic neurologist, clinical nutritionist, and transformational speaker, Dr. Z is an expert in topics from heart disease, diabetes, autoimmune disease, obesity, cancer, hormone issues, nutrition, and fitness. He is the author of the groundbreaking new patient-friendly guide, Rebuild: 5 Proven Steps to Move from Diagnosis to Recovery and Be Healthier Than Before, the only program that allows readers to create a personalized plan based on their unique health needs. Years ago, Dr. Zembroski's own diagnosis of non-Hodgkin's lymphoma led him to create the Cancer Victor Protocol, a research-based parallel set of steps that augments the function of chemotherapy and radiation treatments and leads to better results and a more rapid recovery. Welcome, Dr. Zembroski.
Thank you for having me.
Thank you. So to begin with, tell us a little bit more about your story and then how you got into functional medicine.
I've always had a passion for fixing people. Once I got my doctorate, I kind of got stagnant in my practice for a period of time, and I was introduced to functional neurology, which then took me into a whole other tangent in my practice, treating what they call difficult cases. And these kind of cases seem to improve quite a bit. So during that period of time, my life exploded and imploded, where emotional stressors, major issues here, like it's a horror story out there with a drug addict stealing from me and to support heroin, and the feds arrested her, and my life just seemed to be crazy. And then as I couldn't manage my stressors then, and I tell everybody I had to change my perception of stress, and I couldn't at that point, 18 months later, I had a 5-inch tumor in my chest.
Ugh.
And so the cancer was non-Hodgkin's lymphoma. So I decided to go through, in fact, I think I didn't have any real choice, Betsy, but to go through 7 months of hardcore, nasty, obliterating chemotherapy. They said they were going to give me the strongest stuff.
Wow.
So I endured that. And then I actually, at the end of all that, I pushed the surgeon to crack open my chest about 18 inches to remove the tumor, a procedure they say they've never done before. So up at Yale University, they now call it the Zembroski procedure, that these people go through chemo and then cut their chests open. I'm like, well, good for them. And when I woke up, not to take up all the time here, but when I woke up, the first thing I thought about was rebuilding myself. And so that's been my mission since. So I dove into the research, and I wanted to know, what can I do to rebuild myself and actually come back better than I was before? So I did. And so I journaled this process and rebuilt myself to a place I think I was better even at 25 years old. So my patient said to me, continuing on my story, my patients got great results with the same protocols. And then they said, hey, continue your clinical research and application, but what you really need to do is write a book. And so I did. And so it took me several years to write Rebuild. And Rebuild, as you said, it really is, Betsy, the only program, because I'm coming from, as a clinician, I'm coming from personal experience. It's the only book out there, if you will, that allows the reader to create a personal plan unique to their issues, regardless of what the issue is. Whether you want to get off medications, you're going through cancer, you want to get lean, you want to resolve hormone-based issues. I've outlined what people need to do to resolve and rebuild from those issues. And so I guess Rebuild became my calling, which led me into functional medicine.
Wow, that is an incredible story. So, and you mentioned a lot of stress kind of driving this when you lost your health. So why is it then when people are into stress in general, it seems like their immune system goes, a lot of times they end up with gut issues and symptoms. Can you explain?
So stress is a perception. right? So it's a perceived thing. Unless you're cold or you're hot, you shiver or you sweat, right? Those are physical stressors that we adapt to. That's normal. But most people can't change their perception of a stressor, even during COVID, the pandemic. They can't change their perception. It's doom and gloom. Ultimately, your perceived stressors drive cortisol, epinephrine, norepinephrine, adrenaline into the system. Cortisol is very life-saving. It regulates your blood sugar. It's an anti-inflammatory. But cortisol also will suppress the immune response. So as you think about it, anybody that maybe yourself or someone you know, when you're under stress, you become sicker or you become immunosuppressed. And for the gut and the connection between the gut and the brain, cortisol will suppress a white blood cell or an antibody called secretory IgA antibodies. And that's the military that lines the gut. That's the military that supports our gut function. So when we're under chronic stress, cortisol is released. Cortisol suppresses all aspects of the immune system. You know, even during this time, people are wigging out, but cortisol will suppress natural killer cells and cytotoxic T cells, two major white blood cells that destroy cells infected by viruses. So if you get stressed, you're going to put yourself at risk for infection. Regarding the gut, cortisol will affect the immune response then in the gut and surrounding the gut, which will then allow for bacterial overgrowth, and the immune system can't regulate that. And then we develop leaky gut or gut permeability. I'm sure you've heard of leaky gut syndrome.
Oh, yes.
And a lot of the gut professionals out there will say, oh, it doesn't exist. It's proven through data. It's proven through research that a leaky gut is created by over too much alcohol. Gluten is the number one protein to destroy all humans, and that's the number one protein to create a leaky gut. Cortisol will also do that. So when cortisol wrecks your gut or causes those tight junctions in your intestinal wall to open up or become permeable, proteins and foreign objects can get into the blood. Those antibodies are released from the B cells that surround the gut that creates systemic inflammation. And tying in the brain factor, cortisol as a stress hormone will aggravate those tight junctions or at least the leaky gut. We get an immune response. The immune system creates systemic inflammation. I'm sure everybody is familiar with inflammation. But what's unique about cortisol and the gut is when inflammation happens in the body, it's also going to happen in the cortex, in your nervous system. So there's white blood cells called microglia that then are activated. Those turn on inflammatory compounds or control them or regulate them or turn them on or produce them rather, that called cytokines. Cytokines wreck your brain. And so when you're talking about in your summit, well, oxidative stress, neurological damage, changes in synapses, not enough neurotransmitters interacting in the synapse. That's what's happening with cortisol stress in your gut. So it's amazing. And think about people when they're under stress, they get diarrhea, they get constipated, their guts off, they have maldigestion, poor ability to break down foods, and ultimately bacterial overgrowth and leaky gut, which then creates millions of conditions. It's absolutely insane. Cortisol will wreck your gut and your brain.
Oh, so then what happens? I mean, you're already noticing all these digestive issues and brain fog and things like that. Then what happens after the gut becomes permeable?
So we realize, or let's say someone is under stress, people who stress out comfort eat. They eat foods to soothe them like sugar, fat, and salt, right? And things loaded with gluten, which then perpetuates inflammatory problems in the gut. We see it through stool testing every day. Secretory IgA levels rise. That's telling us there's dysbiosis. And we also, to mention this, we also measure a protein, Betsy, in the system called zonulin. Yeah. Zonulin is a protein that is created from the interaction of gluten and the bacteria. Zonulin will 100% will create leaky gut. So let's throw comfort food eating. Let's throw gluten in there. Let's throw mental stress and uncontrolled mental stressors for people, and you're just setting yourself up for an inflammatory gut brain problem. I mean, if you think about people with gut issues, they have brain fog. They don't think well. Their memory is sucking wind. So there really is an issue, and it's been proven through the data that there's a direct link between the gut and the brain. And then to answer your question directly, you cause systemic inflammation in your brain. That's what happens. And those are the microglia that are creating havoc, destroying synapses, wrecking the way neurotransmitters work, and ultimately changing a protein called brain-derived neurotrophic factor, which I think a lot of people aren't discussing, which we need to discuss.
Yes. Yeah, go ahead and tell us more about that.
So it is just turmoil. Brain-derived neurotrophic factor is produced in the brain that make the connections more, make the synapses and the neurons more connected. It's a protein that allows greater growth of neurons. And so let's say you exercise, you stimulate brain-derived neurotrophic factor. Let's say you eat nuts and seeds with vitamin E, or fish, or curcumin, or caffeine, or green tea. You're essentially turning the brain on to make this growth factor to make your brain more efficient. And if stress is wrecking your brain, well, you need exercise. You need to eat nutrient-dense foods, anti-inflammatory foods, to actually produce this growth factor to reset your brain, right? You're rebuilding the pathways of the brain. You need to rebuild your brain, change your perception of stress, eat good food, re-inoculate the gut with good bacteria, and all of a sudden you're going to see a new brain. We see it over and over again. So it's a serious growth factor to be reckoned with, and we do have control over what we can do with it.
Wow. So yeah, we're doing things that increase our BDNF. We're staying away from stress. But you mentioned a little bit about like changing our perception of stress. How do you do that, or what do you mean?
So have you ever been stressed?
Yes.
So what do you do to get your mindset out of it?
Say it's exciting.
So everybody has their method of changing their perceptions.
Okay.
You pick me up, you have a brand new car, somebody slams into your car, you freak out because you just damaged your new car. My perception is, hey, no big deal, let's go get it fixed. I have a great auto body guy. Okay. So we have to change our perception of the stressor and change our importance of something. You get into a fight with your husband, a partner, a friend, a colleague, a boss, whatever it is, anybody. Change your perception. If you can change the importance of something in your mind, you reduce the fight or flight response, right? I mean, look at the news. The news is so destructive to people right now because, as you know, people are being brainwashed to think a certain way. And as soon as people get that into their mind, the stress reaction, which is an utter nightmare. So to reduce the flood of stress hormones into the bloodstream, change your perception of the stress. If I thought to myself years ago, like, hey, I had nothing to do with someone stealing and heroin here. I didn't change my perception. Stress destroyed my immune response. And guess what I developed? An immune disease. Mm-hmm. So now that I look back at it, I'm like, I had nothing to do with that. All I needed to do was just think clearly through a situation. And the stress hormones would have been minimized. And I probably wouldn't have gone through what I've gone through.
Right. Wow.
So change your perception of your stressors. That's how you minimize the reaction in the body.
Yeah, we have more control than we think.
Absolutely. And I don't think people have control over their control because it's just, everything is crazy now.
Yes. Yeah. So how about the gut's role in our neurotransmitters? I know you mentioned that briefly. What are neurotransmitters? And then how does the gut affect how we think and our feelings?
So neurotransmitters are chemicals that allow the nervous system to work. Some of them are hormones. Most of them are hormones. But these little chemicals like dopamine, GABA, serotonin, norepinephrine, epinephrine, progesterone, different nerve chemicals turn on or attach to receptors in the nervous system that then causes a reaction. So let's say, I'll use food again, for example. Let's say you eat something like tryptophan, or you eat something that the feel-good foods, fat, sugar, salt, that then once it's in the gut causes the release or more so release of serotonin. Serotonin's the feel-good, right? A neurotransmitter. Let's say somebody's gut is poor and they're not eating nutrient-dense foods. How are you going to make cement if you don't have ingredients? And so if you don't eat nutrient-dense foods and you're stressed and cortisol is ripping through your gut with an inflammatory issue and there's a leaky gut, there is no way to produce proper neurotransmitters that run the brain. Yes, serotonin comes from your platelets and different areas of the nervous system create some of these neurotransmitters, but the reality is your gut is the major place for the production of these chemicals that run your nervous system. Dopamine gives us drive. Serotonin makes us feel good. GABA makes us calm down, right? Like if you drink alcohol, it changes chloride. Chloride changes GABA in the brain, and then we feel relaxed. So I'm not saying for viewers to drink. I'm saying that there's a reality to when we eat or do something, we change the gut, which ultimately changes the brain by regulation of hormones, regulation of the neurotransmitters that it produces. Leptin is another one, right, as an appetite hormone. We control that. We control ghrelin if you choose to do so through food, through body composition. Cortisol will wreck leptin, and then you overeat because cortisol has messed up your brain's ability to use leptin, and your appetite's out of control. When you're not really hungry, it's just tricking you to think you are, and then people go out and they eat more garbage. So neurotransmitters and hormones run brain. The gut is intimately involved with the production of neurotransmitters and hormones that we control. And I don't think people realize we have more control over any health issue than we're led to believe. Which is kudos to you getting this information out to people. You just need information. People just need information. And once you have data, that's when you can take control. Change your emotions, improve neurotransmitter dysfunctions. We see it all the time.
Oh yeah, that has major implications for depression, and serotonin uptake and things like that as well, right?
So just a 2-second thing on serotonin and depression. The research shows now, real research, not what you hear in the news, that depression physically, clinically is an inflammatory disorder. And so white blood cells create cytokines that prevent the conversion of tryptophan into serotonin. So we technically, in the nervous system, our serotonin levels do drop because of an inflammatory response. Now, it's easy for a psychiatrist or a doctor just to recommend an antidepressant like an SSRI, but you didn't fix anything. Nothing was resolved. So we see it all the time. And inflammation, which is still linked to the gut and the brain, is associated with the major reason behind depression.
Wow.
Yeah.
Yes, people things to think about, looking at the root cause versus just like what is a symptom and what's a Band-Aid.
If you don't find and fix cause, then you're in the black hole of statistics. Then you become one of the 400,000 people that die every year from hospital and medical errors. That's no joke. That was out of the Patient Journal of Safety.
Oh, wow.
So it's amazing. We need to control what happens to us.
Yeah. Well, and that really goes back to the concept of functional medicine, right? Because you're looking for the root cause of illness, right?
Always cause, always cause. Like I think there's some old adage that asks the question why 7 times and you get to the answer. It's true. And so you have to dig through layers before you understand what happened. Why am I depressed? Well, you have elevated cortisol. You have a leaky gut. There's gut dysbiosis. Who's looking at bacterial overgrowth when someone has depression or anxiety? That's the first place you should look.
Yeah, absolutely.
So yeah, it's amazing. Functional medicine really is where to be right now in 2020.
Oh, yes. So how about, like, if you have gut issues and you may have depression, you may have some brain issues, but you realize, this might go back to my gut. Where do you go? Like, let's talk about rebuilding the gut. Where do you start?
So we typically test people for gut function tests through stool testing, as we mentioned before. So stool testing is absolute paramount nobody wants to collect their stool. However, the benefit of doing so gives us information about inflammation, inability to digest food, and so forth. Once we find out what those problems are, I typically recommend, or what I recommend is people rebuild the gut. Well, number one, stop injuring it. Minimize your alcohol. Check bacterial growth. You can always take a good probiotic once a day or something. take foods in that re-inoculate or feed the gut bacteria with prebiotics, food for the probiotics. So that could be soluble and insoluble fibers. There's plant-based medical foods that we prescribe or recommend to people that provide those nutrients for the bacteria so they can rebuild their neighborhood, their network. Something else that would also benefit people to heal from like leaky gut would number one be probiotics, but L-glutamine. It's not just for skeletal muscle, but L-glutamine is absolutely paramount for people with gut issues. We give it to every person that's going through cancer care and chemo. Glutamine helps rebuild the lining of the gut. That's what it does. So curcumin does that. Aloe can do that. So there really is natural, non-pharmaceutical, non-toxic things we can take to, again, rebuild the gut, the lining of the gut, and re-inoculate the gut with good gut bugs, feed the gut bugs, and that's really our protocol. We take away the injury, we stop the leaky gut, then we go in there and we rebuild the neighborhood.
And what are the soluble and insoluble fibers that you're talking about?
So you can, I don't want to say grains, but you can get a lot of the soluble, insoluble fibers from plant-based foods, which include grains. But I would encourage people that if you're going to eat a grain to let the bacteria do a better job, just make sure it's gluten-free.
Okay.
Right? So if you don't want to eat gluten, if you're dealing with a mood disorder and a gut problem, a stress-related mood disorder and gut problem, absolutely no gluten. I'll challenge anybody on that. Whether you have a genetic predisposition to a gluten intolerance or not, it just seems to be across the board. It's not something we should be eating.
Okay, so you're thinking like, you're talking gluten-free oats maybe, or rice.
Yep, so black rice, brown rice, wild rice, gluten-free steel-cut oats. Those are great grains, if you want to call them grains kind of thing, that supply the soluble, insoluble, or insoluble. All your fruits and veggies have the same. Just eat what Mother Nature gave us. Just stop eating things that injure us. Bread, dairy, sugar. I mean,
yeah.
It's so simple. It really is so simple.
Right. Oh my. So, yeah, what are some other specific nutrients you might add, like besides L-glutamine and besides the foods?
So I typically like to give people L-glutamine, aloe. If someone has constipation because of a thyroid problem, typically that's why we see constipation in most people. There's a weak thyroid, undetected thyroid problem. We use an aloe pill, so just a small, tiny little aloe pill to help them eliminate, for one. But we also use things, green tea is a great extract. Cruciferous vegetables are a great food source to get rid of lipopolysaccharides, these inflammatory compounds that come from the breakdown of the cell wall of bacteria. So when bacteria die, they release these little components of their cell wall called lipopolysaccharides, which gets into systemic inflammation and is directly linked to abnormal brain function. So again, it comes down to gut and diet, and of course, cortisol and stress. But there's aloe, there's glutamine, there's aloe pills for constipation, there's medical foods, pea and rice-based medical foods for providing prebiotics, green tea, curcumin. These are phenomenal for the gut. I mean, these are the mainstay things, Betsy, that we give people when they have a gut problem. It doesn't matter what the gut problem is, whether it's ulcerative colitis, for any mood disorder, it doesn't matter. I'm always looking at the gut and hormones, and that's how we dive into the system deep there, and then we recommend these nutrients when we see necessary.
Excellent. So tell us a little bit about your book, Rebuild.
Ooh, do I have 30 seconds or 30 minutes? So,
somewhere in between.
Rebuild, as I said, was created out of my story, and then my patients actually pushed me to write it, not because of cancer, just because of when I realized going through cancer care when I got done, the medical profession is phenomenal at plugging a hole. They're phenomenal at extinguishing fire, but they have no training or data, if you will, on how to restore physiology. So as I said, when I woke up from my surgery, I said, what do I do to rebuild myself? So I dove into the research. I read books. I went to online journals. I did everything. And I was like, you know what? I just can't seem to get a grasp on what I should do to rebuild my body. I wasn't even thinking about cancer anymore. I just said, my body's been obliterated. So my hormones were gone. My bladder was screwed up. I had a foot drop on my left side. I had brain fog, just symptoms after all the drugs.
Yeah.
I dove into the research and found it myself. And so I put it together in a protocol, again, called Rebuild. And really, what I tried to do was give people information for you to fix yourself without the need of a doctor. Now, that may sound simplistic, but in chapter 8 of the book, there's lists and lists of tests people can go out and get done, bring it to your doctor, whoever you're going to see, a healthcare provider, naturopath, chiro, it doesn't matter. Get the testing done so you know where these issues are coming from or what may be involved in your thing. So I think I'm very proud of that chapter because I want to give you what I would give you if you walked in my clinic. So the book really is a roadmap. It's a personal guide for people to understand why they have disease and what they're going to do to restore their health no matter what the disease is. And again, I'll tell everybody listening or watching, a diagnosis is not your destiny. No. You have to realize you have more control over what's happening to you than the world will lead you to believe. So I created it as a roadmap anybody can follow with hormone issues. You want to get off medications. You want to make the medications more effective. You want to get lean. You want to build lean muscle tissue. You want to reverse cardiovascular inflammation. It is all in there. Why? Because I did it for myself and countless other patients. And I just felt the need to get this information out to people. So I'm very excited about it.
Yeah. Sounds quite comprehensive. Really great.
It is.
So what do you personally do now, like to fortify your brain on a regular basis?
One, I continue to exercise. Mm-hmm. So, and by saying that, it's not just I'm fortifying my cortex, my brain, but it's all systems a go, right? I want to reduce insulin. I want to regulate insulin rather. I want to reduce oxidative stress. I want to make sure inflammation's not wrecking my brain and the rest of my system. So exercise for me is paramount. High intensity interval training, bar none, has the greatest research behind it with brain-based activities, youthfulness, the aging system, muscle weight, regulating hormones, and so forth. So that includes cardio and weights. I also eat nutrient-dense foods. I'm a varietarian. Mm-hmm. I eat a whole variety of food, and I don't eat crap. Okay, once in a while I'll have pizza, chocolate chip, a nice cold beer. I won't deny that. That's not my diet, though.
Right.
So I eat nutrient-dense foods 4 or 5 times a day. I eat plenty of fats. I eat plenty of nuts and seeds. I eat plenty of plant-based foods and protein. And it's no joke. It's just what I do. So I fortify my brain with nutrient-dense foods, high-intensity interval training, and then nutrients. I take curcumin every day. I take a fish oil every day. I take vitamin D every day. That's a whole other topic, vitamin D and brain activity. Vitamin C, B vitamins. I take a multi. Why? Because I know in my daily life that in between patients running around doing different things, sometimes I'm blocked in my schedule for eating. Mm-hmm. So supplements are there to repair. It's not your mainstay diet. You don't eat supplements for food. You repair the broken, the potholes in the road with supplements. That's why we're using them. So I take specific supplements, N-acetylcysteine. If I don't, I always sleep. So if there is a weird night that I don't sleep, phosphatidylserine drops cortisol, so you sleep better. Yeah. Vitamin D, vitamin C, B vitamins, multivitamins, curcumin, just a slew of different things that I have rebuilt my health with, rebuilt my brain with. I mean, I literally feel fantastic.
Great. All right. Well, thank you.
My brain is firing, I think.
Yeah, very, very well. I don't know. Is there anything else you wanted to add to the discussion?
So, I mean, again, in your putting this together, I think people have to change their perception of their stressors to normalize cortisol. If you can do that, you will save your brain, your hormonal system, your body composition. If you're going to work on your gut, think about getting stool testing done. It can be done through Genova. It can be done through different labs out there, just to understand what may be happening in the gut that may be messing with your brain.
Right.
Reinoculate the gut with probiotics, or consider, right? I can't give medical advice. I can only make considerations here. Yeah. Consider a probiotic, consider glutamine, consider curcumin. And if you can reduce and rebuild the gut so you don't have leaky gut and you reduce systemic inflammation, I assure you, your brain will work differently. It happens every single time we intervene with somebody with these issues and their brain improves. So, and stop injuring it. As a last note, please, folks, get rid of the gluten. Yeah, I know there's gluten-free water and gluten-free bubble gum. That stuff is all just marketing stuff, right? I mean, it's just silly.
Yeah.
So there's like, it's like CBD. There's CBD in everything. There's CBD in hair stuff and shampoo. It's in toothpaste. It's in water. I'm like, oh my gosh. Craziness.
Literally.
Get rid of gluten and you've reduced most of the systemic inflammation that can create leaky gut and reduce systemic inflammation that will change your brain. It's 3 simple steps. It really is. I know it's a little more complex internally, but those are the actions that would make big impact for people in their brain.
All right. Wow. Thank you so much for that and for all your expertise. So where can people go to find you online, to find your books? And I know you have a practice as well.
So I am the clinic director of the Darien Center for Functional Medicine. We are in Darien, Connecticut. My website is drzembroski.com. And if anybody wants more information about me, my story, certainly to read more about the book, to order the book, it's on all the major retailers, BAM, Barnes & Noble, Indie Books, all of those. And I'm certainly happy to answer any questions. We have a gift. We are giving people an ebook on how to improve your energy. I think you saw that. Mm-hmm. So yeah, it's drzembroski.com, and all our social media links are there as well. And we send out a bi-monthly newsletter for people to rebuild from disease. Let me throw that in there.
Yes, absolutely. And that's a great resource. So,
yes,
all right. Thank you. Really
thank you so much.
Yeah, great to have you here. And yeah, we'll see.
Good luck with the summit. Like, it's a great thing. You're doing a great thing for people.
Thank you. Thank you so much.